Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter K. Today I'm going to talk about a special condition. It's a serious complication of diabetes, particularly type 1 diabetes. I'm going to explain it. It's called ketoacidosis. Is there an emergency situation associated with this ketoacidosis? Actually, 100% it's an emergency. There's no way you can manage home, and there's the sooner the better, because I'm going to explain it. So what is this ketoacidosis? What are the signs? So this ketoacidosis particularly occurring to those diabetes patients, type 1 diabetes. If you recall, there are two types of diabetes, type 1 and type 2. And there's another one, it's called gestational, which is occurring in the pregnant woman. So this, but in general population, female or male, type 1, type 2 diabetes are the classic classification, conventional classification of diabetes. So basically, if you recall, I had a previous video mentioned, type 1 diabetes is really usually caused by genetics, start at early age. And it's that the insulin, if you recall, the pancreas has many of islets inside of those island-like structures called islets. Inside of those islets have different kind of cells. Beta cell is responsible for secreting insulin. So in type 1 diabetes, those beta cells not function through autoimmune or genetic. Pretty much, I think it's autoimmune. It's the major causes for this type 1 diabetes. Cause a destruction of this beta cell, so there's no insulin produced in the body. So those people has to rely on the insulin lifelong through the injections. So for those people, if undergoing the stress and then cause this acidosis, because the metabolism it's not for under stress, the dose of insulin is not enough. So then the body, through the metabolism of the fatty acid, which are use the fat to generate energy, and the side product of this fat metabolism, not complete, partial metabolism of those lipids, generate those acidic chemicals like acetone, acetoacetone, or hydroxybutyrate. So those are all the very acidic chemicals circulating in the blood, cause this acidosis. If you recall, the acidosis, which means the pH is really low, the hydrogen is really high, because those molecules have the high capacity to give out the free hydrogen ions, so that circulate in the blood, cause this acidosis. So this is the mechanism. The significance for this acidosis, if you can imagine the body cells bathing in these acid solutions, so that's really from the lung, from the brain. So the lung will compensate, and the kidney. The lung is a major compensating mechanism for this acidosis. So there will be a special kind of breathing, very fast, very deep. Try to breathe carbon dioxide, which can carry the hydrogen out of the body. So that's the mechanism for this compensation, but this compensation is limited. So there's special way, just the body is trying to maintain the homeostasis, trying to bring this hydrogen out through this respiratory compensation mechanism. And if you imagine the brain cells, nerve cells bathing in this acidic fluid, so it's really cause the coma. So that's usually patient with this kind of ketoacidosis really develop. In addition to those special type of the breathing, also coma, and breathing has a special, particularly the body has an odor, which is like a fruit odor, because acetone has this special smell like that. And in terms of that, like I said, it occurred usually in the type 1 diabetes patient, and with under stress or insulin dose not adjust along the diet, so cause this acidosis. It's really quite a serious condition. Compared to the type 2 diabetes, it also can have the coma situation, either hypoglycemia by overdose of insulin, or the hyperosmotic caused the coma. But in terms of management and mechanisms, totally different. That's because the coma occurred in type 2 diabetes, usually caused by the glucose is too high, cause this high osmolarity in the blood. You imagine if the osmolarity is high, then dragging the fluid out and the cells shrink and then not function well also. But the consequences are the same, loss consciousness and the coma. In terms of management of this ketoacidosis, insulin, the first line, just give insulin to adjust the mechanism, the pathway of metabolism. At the same time, to use some alkaline to neutralize this iron, and also to promote kidney to get rid of extra hydrogen, so then bring balance. And this is very so that is really usually for this kind of patient managed by the ICU, because it's really kind of dangerous. And also the insulin has to be scaled on the special scale doses based on the pH, based on the hydrogen level, based on the other comorbidities. So anyway, so what are the like I said, the risk factor, and for the otherwise, the take-home message for this, really for those who has type 1 diabetes, close contact with your physician in terms of your change your diet, change your exercise schedule, or your life is not as usual, or extra stress. Really keep informed to your physician, so to adjust glucose, to adjust the insulin, and also to measure your glucose and follow the schedule, have a chart very well managed, so that can prevent this ketoacidosis. The same thing, the same idea for type 2 diabetes. Even though you may not have this ketoacidosis, but the other, the unmanaged hypoglycemia is also quite dangerous, because this hyperosmolaric coma is also can be associated with this changing lifestyle, changing diet, changing exercise schedule. So these are all the in terms of the conditions, you need to really you keep your physician informed, so that can adjust your insulin dose or other medication dose. So this is about the ketoacidosis. Really, it's if in terms of in medical field, it's professional. It's a whole lecture about this ketoacidosis, because from the mechanism, from the management, particularly the management in terms of bring the glucose down, get the ketone out of body, and follow the replacement. There's a full scale of regimen in terms of how to manage this. So that is for the professional, the physician's prescription, physician's management. But for the patient, this is the take-home message. Look for those signs, look for those risk factors, and then keep your physician informed in terms of your change of diet, change exercise level. So make sure it can be adjusted. Insulin can be adjusted accordingly. So this is about the ketoacidosis. It's touched some bases, not deep, but I hope it helps. Just as a reminder for those who have type 1 diabetes. I think you probably already know, your physician probably already mentioned to you. So I'm going to stop here. Thank you for watching. I will see you next time.